Child has convulsions. Now stopped. No signs of meningeal irritation. Negative Brudzinski's Kernig sign and anterior fontanelle is at level. What you will do next? EEG for diagnosis of epilepsy. So no signs of meningeal irritation, negative Brudzinski's Kernig sign and anterior fontanelle is normal. That means this is not from infection. This can be from epilepsy. So you will consider EEG for epilepsy. Next is child after complete control of an attack of seizure in ER. All labs normal, no septic focus. Again, same thing, negative Brudzinski's. That means there is you control the seizure in ER and labs all normal. That is the electrolytes are normal. There is no focus for infection. That is, there is no septic focus. So you will consider this may be a case of epilepsy. You will consider EEG. Next is holding breath attack. This is breath holding attack. Whenever there is, for a child, you will reassure the parents. You will tell them there is a factor that will cause for the precipitation of generalized tonic-clonic convulsion in this reflex anoxic seizures. What increases the incidence of epilepsy? I don't know what is the answer here. He has written atypical seizure. This question is not clear. You have to check what they are asking. Patient with status epilepticus, which is not a common cause. The not a common cause is cryptogenic epilepsy in children. A toddler is 10 months old, stretches head and extends arms for a while back to normal. EEG spike and waves. So you know that infant and he's stretching hands and extending arms and flexing trunk, flexes the head and the trunk and extends the arm. This is infantile spasm. And the EEG here is the hips arrhythmia. It will be clear in the exam. Not to worry. Next is a previously healthy 7-year-old child. A previously healthy 7-year-old child suddenly complains of headache and falls on the floor. When examined in ER, he is lethargic with left central facial weakness and left hemiparesis and conjugate ocular deviation to the right. They have written acute infantile hemiplegia, but I have to know what is acute infantile hemiplegia. We will read this column later to check what it is, okay? Next is worse prognosis of neuroblastoma. If less than 1 year, good prognosis. If more than 1 year, it is not good prognosis. Next is 6 years old child presents with straddling gait. Straddling gait, inability to stand or walk without support. He's 6 years and he's not able to stand or walk without support. He's irritable with vomiting 3 times. And he has history of chicken pox 3 weeks ago. On examination, all are normal except resistance when trying to flex his neck. That is neck rigidity. Resistance when trying to flex his neck is neck rigidity. What is the most likely diagnosis? It is meningoencephalitis. This is not acute cerebellar ataxia. This is meningoencephalitis. What are the points which are supporting history of chicken pox 3 weeks ago? He is irritable and vomiting. And examination, there is resistance when trying to flex. All this is going with infection. And another thing, he has straddling gait and inability to stand and walk without support. Okay, you are performing a well child examination on a new patient. That is 1-year-old child shown in the picture with left eye squint. Your next action should be refer immediately to ophthalmology as the central vision may fail to develop if the diagnosis and treatment is delayed. Now, the child is 1 year old and he has left eye squint. If you leave this child without referring to ophthalmology, there can be his central vision may fail to develop. Okay, a case scenario of a 5-year-old girl with generalized convulsions. She's 5-year-old girl with generalized. Then post-ictal with GCS 10, BP 95/60, respiratory rate 54, heart rate 110. Which sign indicate increased ICP? Focal neurological deficit. So here we should know what are the signs of increased ICP. Whenever there is raised ICP, we will have tachycardia, hypertension, we'll have bradycardia, sorry, not tachycardia, bradycardia, hypertension, irregular breathing. But here there is no bradycardia and the hypertension is also not there. 5-year-old child normal BP is 70 plus 5 into 2. That it should be 80 and above. So the normal BP is this child will be 80 and above. In hemolytic uremic syndrome, renal failure, for seizure control, consider prophylactic phenytoin. In patients with neurological symptoms, 20 to 40% of patients have seizures. Children have seizures, than in younger children. So in hemolytic uremic syndrome, renal failure, if there is seizures to control, we will consider prophylactic phenytoin. In hemolytic uremic syndrome, renal failure, for seizure control, we will consider prophylactic phenytoin. Common solid tumors in toddlers. Common solid tumor in toddlers is nephroblastoma, but in infant is neuroblastoma. We should remember this. Common solid tumors in toddlers is nephroblastoma, but in infants is neuroblastoma. Ascending paralysis. Ascending paralysis is recognized in Guillain-Barré syndrome. We see ascending paralysis in Guillain-Barré syndrome. Treatment of Guillain-Barré syndrome is IV immunoglobulin. So hypoxic ischemic encephalopathy, failure to thrive. Most common associated with parasagittal hypoxia is hypoxic ischemic injury, failure to thrive, and it is affected the parasagittal area. We will have spastic quadriplegic CP. HIE, most common associated with periventricular leukomalacia, is spastic diplegic CP. Child with fever. Child with fever, GCS 7. Child with fever, GCS 7. So the next question, child with fever, GCS 7, focal seizures. MRI showed temporal lobe enhancement. So it is HISV encephalitis. Contraindication for lumbar puncture, except all are contraindications for lumbar puncture except platelets less than 50,000. Platelets less than 50,000 is a relative contraindication. It's not an exact contraindication. If an LP is delayed, empirical antibiotic therapy should be given. Signs and symptoms of meningitis in an infant. Signs and symptoms of meningitis in an infant can be different than those in an adult. Signs and symptoms of meningitis in an infant can be different than those in an adult. Which of the signs and symptoms of meningitis listed below is more helpful in adult patient than in a 4-month-old child, and why? Brudzinski's sign is helpful in an adult patient because 4-month-old child it will not be very clear. Left pneumothorax in an infant with shock. The best treatment is chest tube or needle aspiration. Boy with history of frequent eye blinking, then developed throat cleaning. Then after a few years developed another tic. How to diagnose? The diagnosis of tic is history and clinical examination. Most common type of cerebral palsy is spastic diplegia. Nerve supply to the detrusor muscle and pelvic is the pelvic splanchnic muscle, and to the bladder is inferior hypogastric plexus. Nerve supply to detrusor muscle is pelvic splanchnic nerves, and to the bladder is inferior. The most common cause of primary headache in children is migraine and then tension headache. But tension headache is first in adults, but in children is migraine, the most common cause of primary headache. Now, holocranial headache in child continues for 6 to 8 hours a day. What is the diagnosis? It is tension headache. 10 years old female plus fall down from horse. 10 years old female, fall down from horse. Ten years old female, fall down from horse. GCS 10, good pupil reaction, good gag and cough reflex, had bradypnea and spine radiology, normal. It is spinal injury without radiological evidence. So you'll do an MRI neck to check the brainstem injury because there is bradypnea. Baby got focal convulsion on same side of face plus arm after taking milk bottle and bottle feed. Completely normal. Retinal hemorrhage, especially with history of trauma, because this is shaken baby. 1-year-old infant, convulsion involving neck and trunk only. EEG abnormal irregular wave. Hips arrhythmia, diagnosis infantile spasm, ACTH. Bertrand.
अच्छा
1-year-old infant plus convulsion involving neck and trunk only. ECG abnormal, irregular wave, Hibbs arrhythmia, diagnosis infantile spasm, ACTH, then Vega, Bertrand. Child with difficult line insertion has convulsions and now in ambulance take half hour to reach hospital. It since 2 hours, the ambulance staff call you to give any medication for its control. Diazepam rectal or choose rectal or buccal midazolam. Patient with signs of meningitis but H influenza negative and started already on ceftriaxone. Continue treatment till culture results appear. Case of breath holding spell, no investigations needed. Reassurance. Patients with seizures, no focal lesions. What next? EEG. EEG. Girl trial to ride horse, fallen, GCS 10, normal spine on X-ray, but cannot move her legs. What is the best treatment? MRI. What is the best management? MRI neck. Trial to ride a horse, fallen, GCS 10, normal spine on X-ray neck. MRI neck. GCS 10 is good, so need for CT brain, but MRI neck. GCS 10 is good, so no need for CT brain, but MRI. A healthy father with hydrocephalus with meningocele has another child with meningocele. The recurrent risk for another child with same problem, 4%. 2 to 5% is the risk of recurrence. If has another sibling, another two siblings, the risk will be 10%. So if one sibling, 2 to 5%, if two siblings, then the risk will be 10%. If one sibling, 2 to 5%. If two siblings, the risk will be 10%. Baby, 3 months old, feverish with increasing irritability for last 3 days. Today, develop rash on face, hands, and all over. GCS 10, normal blood picture and ABG. Conscious, what to do? LP. 3 months old, feverish, there is irritability, rash on face and hands. GCS is 10, but normal blood picture ABG. Conscious, what to do? LP. Which better MRI or CT in diagnosis of cause of convulsion if EEG not present? Which better, MRI and CT in diagnosis of cause of convulsion? If EEG not present, we will go with MRI. If EEG not present, we'll go with MRI. Baby convulsion at night plus drooling, normal EEG. It is myoclonic infantile epilepsy or benign myoclonic epilepsy. A baby, she has convulsion at night, drooling, but normal EEG. It is benign myoclonic infantile epilepsy. It is benign myoclonic infantile epilepsy. Benign myoclonic infantile epilepsy. Baby with nocturnal convulsion plus during normal EEG, infantile myoclonic epilepsy. Newborn with difficult labor. Picture of Erb's palsy. Infant 3 months with left eye deviation, reassurance. More than 3 months, if it persists, then we have to do central vision will be lost. So ophthalmology has to be referred. 4 years plus accident, GCS 5, heart rate 52, RR 8, important. Heart rate less than 60 and RR is 8 means maybe gasping. So we'll consider CPR. GCS 5, so 4 years old with accident. GCS is just 5, heart rate is 52, that is bradycardic. RR 8 means gasping, so we'll consider CPR. Child with acute onset diplopia. Child with acute onset diplopia. When he look at left side, his right eye convert and improve the diplopia. Right abducent. Child with acute onset diplopia. When he look at left side, his right eye converge and diplopia improves. So right abducent. It should be right abducent nerve, not left abducent. It should be right abducent nerve. Common cause of headache in children, tension, headache. Neuroblastoma. Neuroblastoma, poor prognosis, age more than 1 year. Less than 1 year, good prognosis. Child with rash all over body. Child with rash all over body. Irritability, vomiting, looking ill. What to do? Blood culture. Blood culture and also LP we have to consider because of irritability. Infant with fever, irritability and rash all over body, bulging frontal, heart rate 160, respiratory 60/40. For an infant, it should be 70, right? 72. What to do? It is low BP because for infant, the minimum BP is 70 plus age into 2, 72. It is 60/40. That means here it is low BP. So what to do? We'll give saline 20 ml per kg. Infant with fever, irritability, rash or body bulging frontal, heart rate 160, respiratory rate 45/60. Saline 20 ml per kg. The most common manifestation of neonatal meningitis is irritability. Irritability.